All right, so I'm Dr. Mairead Masuda, and we're going to be talking about gut health today, and specifically, what is your gut telling you? Now, this is just going to be the tip of the iceberg. I know that gut health is such a buzzword right now, but it's for a reason. There is a connection between your gut and so many other parts of your body, and so many symptoms that arise are the cause of your gut. So I'm going to start off. Let's see. Okay, so let's talk about what functions our digestive system has. Basically, we have a GI tract that runs from our mouth all the way down to our anus, and it includes everything in between: our esophagus, our stomach, our small intestine, our large intestine. And it also includes the liver, pancreas, and gallbladder. And the main role of the digestive system is to break down our food, break down the nutrients, and make sure that our body can absorb it. And then once we have all those nutrients into our body, we use it for energy, we use it for growth and for cell repair. And like I said, this is just the tip of the iceberg when it comes to the amount of jobs that the digestive system performs. Our nervous system and our hormones are really tightly linked with our gut health, and they all have to work together in order to function properly. Okay. So this is my favorite picture. I love to show my patients because it talks about what is normal. So what is normal? I have people come to me all the time and tell me that what they're doing is normal. But typically what we want to see is 1 to 3 bowel movements per day. We want them to be well formed, easy to pass. We don't want to see any blood or mucus or undigested food. So I like to show this chart because as you can see, type 3 and type 4, which are well formed, but they should be easy to pass, are what should be your norm. If you're deviating at all, if you are having some type 1, type 2, or if it's alternating with type 1, type 2, and then type 6 or type 7, there's something going on. And something that, is likely caused by inflammation leading to the loose stool and the diarrhea. And our gut is how we get rid of toxins that our liver is processing. It's how we process out our hormones. We need to be having proper elimination in order to get these toxins out, get these breakdown products of our hormones out so they don't recirculate and cause other issues. So what disrupts GI function? Lots of things is the main answer, but things like dehydration. So like I was saying, if you're dehydrated and you're not having good bowel movements every single day, that's a problem. Certain medications can make us constipated. They can also deplete us of certain nutrients. Pregnancy, anyone out there has been pregnant, they know that you can often get constipated at different sections of your pregnancy. So that is an issue. And then you can see this guy down in the bottom left spraying glyphosate on our fields. Environmental toxins can also disrupt our GI function. And then lastly, both food sensitivities or intolerances or allergies, as well as stress. Stress is huge, a huge disruptor of our gut function. So it's always something that I look at. I like to look at all these different things to see what our exposure has been, what our diet is like, and what your stress is like. Let's go through a few of these and go a bit more into detail. So I mentioned.
We'll pause that.
Oh, okay. Wait, am I not showing my video? I have it on.
You see it on yourself?
Yeah.
Okay, maybe it's recording for you.
Okay. Okay, so what I want to talk about first is something that a lot of us have, but maybe not fully realize. There are different things. There are differences between food allergies, food intolerances, and food sensitivities. While most of us would be pretty aware if we have a food allergy, because the symptoms of that would be anaphylaxis. We get hives, we have trouble breathing. We can also have nausea, vomiting, or diarrhea. And that's typically an IgE allergy. Versus a sensitivity, which is on the bottom, that's typically IgG. And these things might not show up straight away. You might eat something, maybe a bowl of pasta, and you feel okay. But maybe a few hours later, maybe the next day, you're like, I've got a headache, I feel kind of foggy, I feel a bit bloated, maybe you get a little bit constipated. That is usually a sensitivity. Now, intolerance is usually not immune mediated, and that's typically a lack of enzymes or also to do with improper GI functioning, where you don't have, excuse me, the enzymes to digest lactose, for example, or for some people who are gluten intolerant. So there are differences between allergies, intolerances, and sensitivities. But the main thing is that all of these things can disrupt your gut function, no matter what the cause, whether it's an allergy, whether it's intolerance or sensitivity. What it does, it usually changes your immune function. And when you change your immune function, you open the gut up to dysbiosis. And dysbiosis is just a change to your gut bacteria, because we all have a set of gut bacteria or microbiome, and we want it to include certain things. If there's anything that's aggravating your gut, like I said, an allergy, an intolerance, or sensitivity, that's going to disrupt the nice microbiome environment, and they're going to get angry, and there's going to be the overgrowth of opportunistic bacteria. So basically, this is one of the first steps, because a lot of us can be eating things that we don't realize are actually affecting our gut health. Like I said, pregnancy. So during pregnancy and the postpartum period, our levels of estrogen, progesterone rise and fall dramatically. And when hormones shift in this matter, the microbiome composition is altered, which increases gut vulnerability to, like I said, pathogens or opportunistic bacteria, which again, in turn, opens us up to possible autoimmune conditions. It can open us up to skin disorders and mental health issues as well. Medications. So there are certain medications that I think most of us know disrupt gut function, such as antibiotics. Antibiotics antibiotics are great. They kill off infection when we need it. They kill off that bad bacteria, bad bacteria. But at the same time, they kill off our good bacteria. Well, bunny ears. They kill off the good bacteria too. So that's disrupting our happy microbiome. And like I said in the previous slide, when that happens, we have dysbiosis, and then we have an angry gut, and a lot of other conditions can follow. So what other medications can also cause disruption to the microbiome is SSRIs, which are usually used with depression. They're selective serotonin reuptake inhibitors. Metformin, which is a really common medication used for type 2 diabetes. PPIs, which are used for, a lot of people are on these proton pump inhibitors, which are used for acid reflux and indigestion, or GERD, and laxatives. So these are things that a huge amount of the population are on, either one, if not a few of them. And a lot of these can disrupt our gut function. And like I have that little guy up in the corner again, spraying his environmental toxins. We are exposed to environmental toxins every day. It's, we can't really get away from it. It's in our water, it's in our soil, it's in the air. And I mean, unless we're going to go completely off the grid and live out in the wilderness and grow our own food, which is not really a feasible solution for everyone, for most people, we're going to be exposed to it in some shape or form. So we know that environmental toxins can, cause toxicity in the brain, in the kidney, and in the liver. Because if you think about it, the kidney and the liver are both, there are processing organs. So they process everything in our body. They filter out toxins. But it also causes gut microbiome toxicity. So again, this is something that I always like to check in on with my patients to see, is this a possibility? Did you grow up near a farm that grew conventional vegetables? Did you grow up near a golf course where they spray herbicide or insecticide or growth hormone basically on their grass to make it nice and green and neat and pretty? These are all things to take into consideration. And it's not said to scare you, because like I said, we're all exposed to some form of it, or at least a little bit of it. We can't really get away from it, but there are things that we can do to help lessen the load, lessen the toxic burden. Okay, stress. There's a reason this is all capitals with exclamation marks, because this is a huge part of gut disruption. So another thing that we can't fully get away from is stress. We all have some shape or form of it. There are things that we can do to, mindfulness practices to help reduce it and help us handle the stress. But it plays a huge role in the disruption of our gut function. We know that stress can alter our gastrointestinal mucosa, which you can see here in the picture, the red picture. What that's showing is that the little guys on the top with the dots in the middle, those are our gut cells. And so stress can actually loosen the tight junctions between each cell, and that allows particles to escape and get through into the rest of our body. So when it does that, which is termed leaky gut, which a lot of us have heard of, when leaky gut happens, our body creates antibodies against these little particles because our body's doing its job. These particles are not supposed to be floating around our body. So it really is doing its job, but that can lead to a lot of different symptoms. So what does that look like? You can start to notice that foods that you're used to eating can actually, like on a regular basis, can actually start to bother you. Perhaps they're causing abdominal pain, they could be causing bloating, brain fog, rashes, and this has occurred with more and more food. In addition, stress can also increase the amount of inflammatory cytokines, which they're little guys who set off an inflammatory cascade. And again, another buzzword, but inflammation is not something we ever want unless it's an acute injury, like you sprained your ankle or got a cut, and you just want that acute inflammation. We don't want any chronic inflammation. So lastly, and I know that I've been saying this over and over, it alters our microbiome. It changes that happy environment of our microbiome. And when that happens, dysbiosis happens. So this is always, even if someone doesn't have any gut dysfunction going on, I always address stress because it has such an effect on our whole body. Okay, so how does this actually show up in our body? One of the areas that it shows up a lot is in our mental health. There is a communication between our gut and our brain. Our gut and brain actually developed from the same tissue during fetal development. And one of them became our central nervous system, which is our brain and our spinal cord, and the other became our gut, or it's also called our enteric nervous system, or our gut brain. And gut brain actually contains more nerve cells than our entire spinal cord, which is crazy to think about. So there's a lot going on in there. It's feeling a lot, it's sending a lot of signals, and it's receiving a lot of signals. And so as you can see with this picture, there is an interaction that the brain has on your microbiome, as well as an interaction of your microbiome on your brain. And they're connected by your vagus nerve. So the brain can release neurotransmitters such as serotonin and dopamine, and that can actually lead to, if there's too much serotonin, it can lead to diarrhea because we have a lot of serotonin receptors in our gut, a huge amount. And then in turn, our gut can also send neurotransmitters to our brain, such as leptin and serotonin, which can signal, that we're not sending the hunger signals as much as the full signals as much as we should. So that's why it's so important to regulate your gut function, to make sure that it's running optimally, because like we've already mentioned, it has so many different effects, not just on your actual gut health itself, like on how many times you're going per day and how comfortable it is, but also on your mental health too. Skin. So the skin is the largest organ in the human body. So if there's any dysfunction in the body, it's most likely that it's going to show up in your skin at some point, whether it's in the form of acne or eczema or psoriasis. And we know now that lifestyle factors such as diet and stress play a really large role in determining how our immune system responds to changes in our microbiome. And so research shows that the SAD diet, or the standard American diet, which has quite like you can see it on the left, a lack of diversity, leads to a less diverse microbiome. And so whether there is a lack of diversity or if there's just straight up dysbiosis going on for some reason, this can alter the body's immune response, leading to the development of skin issues. So that's why it's, again, so important. If anybody comes in and you're having anything that's showing up in your skin, I always examine gut function, see if that's moving properly, seeing if you're having proper elimination so that you're getting rid of any excess hormones. Because if you're not, that can absolutely lead to acne, it can lead to eczema and many other skin conditions. Next, infertility. So when we consider the menstrual cycle, we don't often link it to our gut health. However, month after month, women suffer from debilitating PMS symptoms, whether that's like cramps or extreme breast tenderness or emotional lability, migraines, back pain, and these things can take us out for days at a time. And again, we didn't know about this connection for a long time, but now we know that there's something called the estrobolome. And so the estrobolome is actually the part of our microbiome that is specifically for processing estrogen. It's got special genes. This bacteria have special genes to actually break down estrogen. So if our microbiome is disrupted for whatever reason, like I said, toxins, stress, food sensitivities, anything like that, this is going to throw off our estrogen metabolism. And when this occurs, our estrogen levels increase because we're not breaking it down the way we're supposed to. Poor estrogen metabolism is going to lead to worsening PMS symptoms, can lead to weight gain. That in turn can lead to PCOS. Endometriosis and fibroids are both, but elevated estrogen is disruptive to both of those. And those can all lead to fertility issues. So again, something that I always examine. So you might have been, at the beginning when I was saying what is normal, you might have been thinking, oh my gosh, that's not me. I'm not normal. Maybe you're a little bit off from that. So how do we treat gut dysfunction? First thing to do is find a qualified provider who's going to take your symptoms seriously. Like I mentioned a little bit back, a lot of us have, I think I mentioned it in my PCOS webinar as well. We are taught to think that, yeah, PMS symptoms, they're normal. You're going to get cramps, you're going to feel bloating and all this kind of stuff. And yes, maybe a certain amount of it is true, but it should not be debilitating. It should not be disrupting your life, your daily life. So find someone who's going to take your symptoms seriously and really dig deep and find the root cause for you. So the first thing that I like to do with my patients is to assess for gut disruptors. And I mentioned this in the previous slide. Are there any medications that could be causing this? Are there any food sensitivities? Is there a high amount of stress that is likely leading to this? The next step would be to use appropriate testing based on what is going on with you. If we think that it is probably due to a food sensitivity, maybe we'll do that kind of testing. We'll do celiac testing. If we're not sure and it seems like there might be some bacterial overgrowth, we'll do something like the GI map or a SIBO breath test to check for small intestinal bacterial overgrowth. So there's different testing and it really just depends on the individual. And then lastly, we're going to find a treatment protocol that's suited to your specific needs, which can consist of, and this is, I know it looks like a long list, but it's just a tiny fraction of the things that could possibly help with gut dysfunction. If you have bacterial overgrowth, we'd be looking at antimicrobials and binders to bind the bacterial die-off. We look at digestive enzymes to make sure that your gut can properly digest food and then absorb nutrients. Probiotics if we're trying to replace the healthy microbiome. How glutamine is wonderful for healing the gut lining. And the list just goes on, talk about transfer factors and colostrum that's going to help the immune function in your gut, as well as bone broth, collagen, things like peptides like BPC 157 is really great for gut healing. And then as we get to the bottom, I talk about neurofeedback, biofeedback, and mindfulness practices, because again, mitigating stress is one of the #1 things that I want to treat, because if the factor that is disrupting your microbiome is not getting treated, it's just going to keep happening. And stress is, like I said, is something that we all deal with in some shape or form. So the goal is find someone who's going to take your symptoms seriously, who is going to examine all parts of your body and make sure that we're ticking all the boxes, find the right testing for you, remove any of the factors that might be causing the GI dysfunction, and then treat appropriately. And like I said, this is a long list of things, but one set of supplements is not going to be right for every single person. It really depends on the individual. And here we offer all these different supplements. We offer peptides. We also do all the gut testing as well to find an individual plan that's specific just for you. So that is my spiel. I'm sure there might be a few questions. Let's see. Okay, so transfer factors, they act kind of like colostrum, and they are little immune, it's basically like more immune globulins. So just like colostrum, when you first have a baby, and colostrum is the first thing that comes in. It's full of antibodies. And for some people, it's like maybe they just didn't get enough. Maybe they just need a little boost, but their gut needs that increase in immune function. So we just support it with something like I said, transfer factors, like colostrum. You know, there's a few different supplements that we carry here that are really helpful at boosting immune function so that it's like giving your gut an army to fight back. Some people's army is depleted and we just need to give it that support. Okay, so what is biofeedback? Biofeedback is basically, I mean, kind of like what it says on the tin. So what happens is you're usually connected to, like, you'll have a computer screen and you're connected to like an electrode of some sort that's going to monitor your oxygen, your heart rate. Sometimes they'll monitor your muscle tension, your blood pressure, things like that. It just depends. And what we're really doing is we're helping you realize what part of your body reacts to stress. For some people, when they get into a stressful situation, their breathing gets increased or their heart rate increased. And so once we find that out, we can help train you to respond to stress better through this biofeedback machine. So it's, again, amazing for anything, but really helpful for helping you deal with stress on a day-to-day basis. You just get tools to help regulate your stress response. And that was another thing that I meant to talk about, was that, you know, stress affects your gut. Yes, it disrupts, you know, causes dysbiosis, but also once that occurs, that leads to a disruption in how you in turn handle stress and how you release stress hormones. I'm doing this because I'm going from my gut to my brain, back and forth. So you want to try and break that cycle. Okay, so yes, so I had a question about SBI Protect from Orthomolecular. SBI Protect, it does have immunoglobulins in it. It's not transfer factors, but it does have immunoglobulins in it. So it's, again, so many different things that you could possibly use. For some people, they like the transfer factors. Some people would do really well with the SBI Protect that has immunoglobulins in it. Some people would do well with like a colostrum powder. There's so many choices. That's why it's so good to find someone who gets to know you, gets to know your case, and can figure out what exactly would be the right option for you. Let's see. So what are some good mindfulness practices? Okay, I'm going to tell you my favorite right now. I like something called, it's an app called Intuition. It involves 24-minute journeys, and each one involves binaural beats, vocals, and like instruments and sounds. And I like it because, for me personally, I'm not great at the meditations that involve people telling me to breathe. That makes me a little bit panicky. So I like to use this one because you just plug it in, and 24 minutes is equal to about 4 hours of deep meditation, which is incredible, again, for everything, but especially for helping with gut dysfunction. I don't know if, you know, I think a lot of people experience this where they're under a lot of stress. It can either hurt their stomach, or maybe it causes them to have loose stool. That is that gut-brain connection happening. So anything that's going to bring about stress reduction, anything that's going to help you manage that stress cycle is going to help with your gut. And so I had a question about, what do I mean by a binder? Yes, I'll explain that. So a binder, which is just underneath antimicrobials, that is something that when I am doing a protocol if someone has bacterial overgrowth and they need to go on a protocol to kill off the overgrowth of bacteria, I always like to use a binder to make sure that any of the die-off of the bacteria is bound up and taken out of your body. Occasionally what can happen is something called a die-off reaction, which typically you might experience some like joint pain, you can experience some nausea, you can experience some diarrhea, but the goal is not to feel like that when you're doing a bacterial kill protocol. The goal is to feel okay. So when that happens, we use a binder because it helps bind up any of the bacteria that's, you know, has died off, binds it up, and it pulls it out of your body. So usually it involves some sort of fiber, or you know, there's charcoal, there's many different kinds. And again, certain ones suit certain people. But that's what it does. Binds up any of the dye off and takes it out of your body, so it's not lingering around, making you feel gross, basically. What do I think about HCl? So I like it. So really, again, it depends on the person. So I mentioned in a few slides back that PPIs, or proton pump inhibitors, are one of the medications that can disrupt your gut function. And the reason it does that is because it is stopping your gut from creating as much acid, which for a lot of people, when they're experiencing acid reflux, that is the go-to. You know, you think, oh, I'm experiencing acid reflux, you're going to be put on a PPI to stop as much acid. For a lot of people, it actually doesn't work that well, because what actually happens a lot for a lot of people, we have a sphincter that's at the base of our esophagus attached to our stomach. And the way that it stays closed is from the acid of our stomach. So if we don't have enough acid in our stomach, it's going to remain open. And when it remains open, it lets anything just spill through. You know, it's not tightly closed. So depending on the person, I do like using HCl because it can help actually increase your gastric acid secretion, which can then actually reduce your acid reflux because it's closing that little sphincter at the bottom of your esophagus, so nothing can kind of come up and cause that heartburn feeling or the reflux feeling. So again, yeah, it depends on the person, but I'm a fan of it. And the reason why I'm also not a fan of the PPIs is because when you're not able to have enough acid in your stomach, you can't break down your food properly. You can't break down your food, you're not going to be absorbing enough nutrients. And so that's what we see after a long time on proton pump inhibitors, is that people are having micronutrient deficiencies, which again can lead to hair loss. It can lead to acne. It can lead to weight gain. It's like the list goes on and on and on, because we need those nutrients. So, any other questions? I mean, if not, you know, we're always here. I'm always happy to do, you know, introductory consults so we can see if this would be a good fit. And so are all our staff here. Let me see if there's one more question come in. Oral bacteria in the stomach. Okay. Yeah, that is another one of my huge things. If you have any, you know, cavities going on, if you have any gum disease, anything like that, if your oral health is not being taken care of, that is like my number one thing to take care of. Because if you think about having all that, you know, a balance of bacteria in your mouth, exactly the same as you want to have the balance of bacteria in your gut. You know, they're both, it's like each end of the spectrum, each end of the digestive tract. You want to be having a good balance of bacteria in both places. So the same thing that can disrupt your gut bacteria can disrupt your oral microbiome. So yeah, if you have cavities, if you have gum disease, if you, you know, use chewing tobacco, don't use chewing tobacco. You know, if you have uncontrolled acid reflux and it's, you know, affecting your oral microbiome. These are all things that I always want to take care of, because like I said, it's just one end of your digestive tract versus the other. They both need to be running optimally. Huh, it's funny, my Apple Watch just told me to breathe. It's time for my mindfulness. So if anybody has any more questions, definitely let us know. But you know, like I said, we're always open to answer these questions to see if you know, it would be a good fit to do some GI testing, to talk about where we could support you in that way. Oh, I got a question about colon hydrotherapy. Again, it depends on the person, but really effective for people who have been constipated, who have like chronic constipation, who've had it for a long time, because number one with gut health is like even more so than if you have loose stool. If you're constipated and you're not going, I want to get you going. So colon hydrotherapy is really helpful for that, to just clear, basically it's like you're getting cleared out. Because like I said, we want to make sure that you're eliminating properly, that you're getting rid of any toxins that have been processed kindly by your kidney and your liver. Make sure that they're processed and taken out of your body, because if they're not, they're staying in your body, they're recirculating and causing lots of skin issues, lots of PMS symptoms, especially if your estrogen is not getting processed. So that is another, it's just another tool in our toolbox that I like to use depending on the person, depending on how they present. Like I said, everything is completely individual depending on the person. No one person is the same, and no one person is going to follow the exact same protocol. It just depends on the person. Okay. All right. So yeah, like I said, I hope to see any of you who are watching this. I hope to see you in here and we can discuss next steps if you're having any of the symptoms that I talked about, any bloating, any cramping, any constipation or diarrhea or anything on the spectrum of my fun chart. Let me see. That is not type 3 or type 4 on the Bristol stool chart. Let me see. Here's my fun. There we go. Yeah, anything that is not type 4 or type 5, or if you're alternating back and forth, if you're not hitting any of these points like 1 to 3 times per day, or if you're seeing any blood or mucus or undigested food, definitely contact a practitioner that you trust. You can always welcome to come here. We'll talk it through and see where it might be coming from and what testing if needed. And then we get treating it and you start feeling better.